karibuni sana to the shift where we are shifting mindsets, we are stirring up purpose, and we are speaking life to each and every area of your life. This is Tumaini TV, where we are bringing hope to the nations. Well, for this episode, we are talking life to your health. We are talking about fertility and infertility issues in both men and women. And our guest today is none other than Mary Nganga, who is a nurse at Bahati Sub-County Hospital. She is also the head nurse in charge of the facility and also in charge of the reproductive health department. Karibu sana.
Thank you very much.
How are you doing?
I'm fine.
How baridi ya juu inakupeleka aje?
Baridi ya juu liko poa, tunapambana nayo. Na
finance bill?
Finance bill inatupeleka hivi, but tunavumilia. Na tunapambana na vile hali iko.
Okay, as it should be.
Yes.
Aya, before we start on the topic, nataka kuuliza tu maswali tudogo tu, but you have to answer within 5 seconds. Each question with 5 seconds. Okay, the first one, what's your superpower as a nurse?
My superpower is when I assist a patient or a client and she feel satisfaction with the service.
Okay. Umejaribu. One food you can eat every day.
Ukimo.
Okay. Okay. Male or female patients who ask more questions?
Female.
Female.
Yes.
Okay. Umefanya vizuri. Umefanya vizuri. That was 15 seconds.
Thank you.
Okay. When we talk about fertility and infertility issues in both men and women, can you explain what is fertility and what is infertility?
Okay. Fertility is the ability of a couple to conceive or to get children. And infertility, we define it as the inability for a couple to conceive within 12 months of unprotected sexual intercourse. Or for a person who is above 6 months, that 5 years, 6 months.
Okay, okay. Can you break down the causes of infertility in, first of all, we start with women. With women? Yes.
Causes of infertility in women, there are many. There are general factors, but there are those that are specifically for women. For women, we can have causes like fibroids, that is growth in the uterus. We also have polyps, also a growth in the mucous membrane of the uterus. We have pelvic inflammatory infections or PID, pelvic inflammatory diseases that affect the pelvic area or the pelvic region that hosts the uterus and other reproductive organs, which is mainly caused by the sexual transmitted infections. We may also have hormonal imbalances, where the hormones are not balancing, maybe they may be too low or too high. We can also have another cause, we call it polycystic ovarian syndrome. Either it is too low or too high, or they are not releasing the eggs in the right time.
Okay. Yeah. What about in the men?
In men also specifically may have problems in the pelvic, with the reproductive organs of men. The other cause, it may be the semen motility, where the sperms maybe they are not traveling the way they are supposed to travel up to the uterus. We also have in cases of male production, maybe they have too low sperm, they are not sufficient to fertilize a woman. Because we say when a man produces a sperm, they may be supposed to be 150 to 200 million in the semen, that they can be able to fertilize a woman. The other can be testicular disorders. Maybe testes are not there. It can also be cancer of the testes, or another cancers that can affect also the male organs, and also infection, like the sexual transmitted infection like gonorrhea, syphilis.
Okay.
And then there are the general ones that affect all men and women.
What are the general ones?
The age can also be a factor. Maybe they are too young or even too old.
Okay.
Like maybe a woman is in her menopause, early menopause or something. The other one can be smoking, alcoholism. With smoking, especially in men, the semen is too low.
Okay.
Yeah. In alcoholism, also in women, and also drug abuse, they affect the reproductive system of both men and women. The other one can also be because of change of climate. Another one can be because of other diseases like diabetes and also obesity. Usually affect all of them, and also stress. This is also a factor which can affect either male or female.
Okay, you have talked about the drugs, the smoking, and the stress. What other lifestyle factors can influence someone's fertility?
Even work, especially for men because of working men in hostile areas. Also maybe drivers because of the heat.
Okay.
And their organs are also down there. Also wearing maybe too tight clothes, especially for men. They are not encouraged to wear too tight underpants.
Okay.
Then the women, also change of environment can affect the hormones. And also sometimes diet also, especially with men, they are encouraged to eat food with a lot of magnesium.
Examples of such foods?
Pumpkins, groundnuts, cashew nuts.
Okay. Okay.
They are good for men because of their sperm motility.
When we talk about fertility, are there types of fertility and infertility? Are there types of infertility in both women and men?
Yeah, fertility we said is just the ability to conceive for both men and women. But infertility we have types. We have the primary infertility, the secondary infertility, and unexplained infertility.
Okay.
And when we talk about primary infertility, is when we say that the couple are not able to conceive within 12 months of unprotected sexual intercourse.
That is primary.
That is primary. They have never conceived before. Those are people who have never conceived any there before. For secondary infertility, it's a couple who has ever conceived maybe one baby or two or more, but they are not able to have subsequent pregnancy. For unexpressed, the cause is not known. Exactly what is causing this couple not to conceive.
Okay. You know, infertility, when it happens to a couple, there are some effects that happens to the couple individually and also collectively as a couple. What are some of the emotional effects?
Emotional effect for individually, especially in women, you get stressed. You get to in a place where you are in a denial. You are wondering, why am I not conceiving? You may also face rejection. Emotionally, you feel like you are not useful. Why am I not able to conceive like other women? And also to affect men, they can also feel like, what is happening to me? Emotionally, they are stressed. Emotionally, they feel like they are useless. Emotionally, they feel like they are not capable. Because generally, they need, if I get married, I need to conceive to have a baby of my own.
And what are some of the early signs that occur to women of infertility? Early signs that if I'm a woman, if I see these signs, I should be so alarmed.
Especially to young ladies and to young women. During puberty, at least from the age of 10 or 12 years onwards, a woman should start getting her menstrual periods, which come every month. So if it delays, you are going even up to 18 years, you have not started getting your menses. This one should worry a woman to go and see a gynecologist to see what is the problem. Why am I not starting to get my own periods? If it's breast, they need to start coming up.
That also affects fertility.
Yes, breasts are also part of the reproductive
organs. Yeah.
So if you are still flat chest, maybe until 18 years, the bulbs have not started growing. You need to get worried. What is happening? If it's that's for female. Mostly that one. The other one is a problem we call endometriosis, which is also a cause of infertility in women. Endometriosis is when the lining of the uterus is placed somewhere else outside the uterus, which is the most common sign is a painful menstrual period.
The cramps.
That are very painful. Even if, despite taking drugs, maybe painkillers, you still have very painful. That a person cannot even go to class if it's a student. Others are even not able to go to work because the period are very painful. This one is, you need to see a gynecologist to see what is happening, because of endometrial tissue being somewhere else, and they are treated medically. Yes. And they also the specialist can also suggest for a scan to see where the problem is, where maybe surgeries also can be done.
What if someone is so used to the pain that they don't know that it's actually endometriosis? They just think that it is the normal cramps. How do you differentiate between the normal cramps and endometriosis?
With the normal clamps, you may feel a discomfort like a woman, sometimes a lower abdominal pain, which you even can go on off without even taking medication. And although maybe taking a simple painkiller like Panadol, the pain subsides. But with this one, even if after taking medication, you are vomiting, you are in pain, very painful situation, that you cannot even be able to work, even sleep, you are even sometimes very uncomfortable, even associating with people. When the pain is extreme, this one needs to be checked. This should not be extreme.
Are there other signs of endometriosis other than the painful cramps?
Mostly it's a painful cramps. The other one can be irregular periods that they come anyhow. That they don't have to follow a certain cycle. Because the normal cycle should be between 21 to 35 days.
Okay.
But these ones that come maybe twice a month, sometimes they don't even come. Maybe you can go even for 2 months without getting your menses. And that this one should worry you. Without a very genuine cause of why. Maybe you have not changed the environment. Maybe you are not under certain medications.
Okay.
Yes.
And what are the other signs of infertility? The other signs other than the endometriosis and late periods or no periods and the lack of the breasts. What other signs are there?
The other one may be fibroids, which sometimes some women may not know, but we have frequent menstruation. Every now and then you are receiving your periods. Sometimes your abdomen is growing big and you don't have a baby. You go for a scan and you get their fibroids, meaning there's a growth in the uterus. So that one you cannot be able to conceive.
Oh, to conceive. But most people don't know that they have fibroids.
Most of the people, they don't know. They may think it's a normal period, but it comes so frequently, and it's
more than one time in a month.
Most of the time it's heavy bleeding, with it coming with tissues.
Are
then the other things, maybe for a woman, you can see congenital abnormalities. Maybe your reproductive system is not the normal one. You need to go for a checkup if you see that there's something that is missing.
Like what?
Some maybe have the vaginal os closed. It's not there.
Okay.
So maybe mothers are the ones who can be able to see when maybe they are washing their girls.
Their babies.
They can see there's something, there is a problem here. This and this is missing in my girl.
Okay, we have talked about infertility. How now do you know that you are fertile as a woman?
As a woman, generally is if you're able to conceive within that period, within 1 year.
What if I'm not sexually active?
If you're not sexually active, sometimes you may not know. Because you say it has to be regular, sexual, and protected sexual intercourse. Okay. Because for a woman, it's not always that you are fertile. There are days in a month that you are very fertile.
Okay. What are some of the days that you are fertile?
The days you are fertile, if we say, is from the 10th to 11th day after your period.
Okay.
And this one you know because you have body temperature sometimes rises. There is a mucus that the discharge that comes from your vagina area is kind of mucus-like, thick kind of mucus, and you also feel like you need to have sex.
Okay.
You feel that you need that urge to have sex.
Okay.
That's where you are in your fertile days.
Now let's go to the male side. How does a man know that he is infertile?
Sometimes you may not know unless you see the obvious changes that are not there, like a man. You maybe see that maybe in your reproductive organs, you may feel your testes, they are not there. This one the men should feel. Even the boys, the young boys, the mothers should know when the testes are there, because they should be born when the testes are down. When you feel that that sac is empty, that one is something to worry a man. Because now when it's in the abdomen, it gets destroyed. They need to be done surgery before the age of even 5 years.
What?
Yes, before they start getting to puberty.
Are there other signs for a man?
Unless a congenital abnormality, maybe in your penis, or any other congenital abnormality you may see. Sometimes it's not very clear. You may think you are still normal until maybe you get married and you're not able to conceive, because it's something like semen production, sperm production, you may not know. Yes, until they go to the lab and then you are tested. Yeah.
Okay. How do you test fertility?
Fertility for men, they should go for semen analysis, which it's being analyzed, where they analyze it, the motility, the morphology, how the sperm look like, are they abnormal, are they normal?
Can you take us through that process? When I say as a man, I'm going for a fertility checkup, how does it go?
When you go to the clinician or the doctor, you tell I need to know whether I'm fertile. One of these test your semen analysis. It's done in the lab, and also some sperm production. You are given a test to produce sperm. You can assume you are elect, so that they may take the amount of the sperm. Are they within the normal limit?
What's the normal limit?
We said it's around 150 million to 200 million in a 1 milliliter of semen. So that one is normal. Then on the semen analysis, they see of which the sperm are they normal. They can be abnormal in shape. They can be abnormal in size. They can also be abnormal in their movement. As they study their movement, they are not moving the way they are supposed to move.
What about in women? How do you test fertility?
And also in men, they can also be done investigation like whether they have any sexual transmitted infection that maybe have affected their genitalia, whether the testes are there. They can also be checked through the physical exam, and also the history taking. Do they have any history of conception before or not? For women, also it's doing the history. You can take a history from a woman, whether she has ever had even a sexual transmitted infection. Does he have the cases of endometriosis or a problem with her menses? That is doing the history taking. Through the physical examination, the doctor will examine to see whether everything is normal physically. By physically seeing, yes, are they normal in size? Are they normal the way they look like? Your reproductive system, is everything normal? Then from there, they can also do the lab test. The lab test will look for the hormones. Are they normal? Are they balanced? Also, what they can do, they can also check is also any presence of any STIs or any infections in your genitalia or in the reproductive system. Then they can also do X-rays. In X-rays, we can see whether the ovaries are normal, whether the tubes are blocked. You can see from the X-rays and the ultrasound of the scans. There are things that can tell you inside the reproductive system. Is everything okay? Uterus, is it in the normal size, the normal shape? Are the tubes normal? Are they blocked? Are the ovaries, any cysts in the ovary or any problem in the ovaries?
Okay. I'm learning. I hope you are learning. I hope you have your notebook and your pen. I hope you are learning something about your body or your health in general. Well, we are going for a short commercial break. We'll be right back. Don't go anywhere, because as we come back, we'll know the treatments of infertility. Don't go anywhere. Thank you so much. We are back. Thank you so much for tuning in. We were talking about fertility and infertility issues in both men and women with nurse Mary Nganga. And we want to debunk the treatments of fertility and infertility, the treatments of infertility in both men and women. So we will start with the women. What are some of the treatments of infertility in women?
Thank you. We'll start with women. One, we would say lifestyle modification. Like if you are obesity, weight loss. If you are a smoker, you can quit smoking. You are alcoholic, because even women nowadays are taking drugs. Maybe and these drugs, they ruin the reproductive system. The bangi, the cocaine, marijuana, all these drugs, they ruin the reproductive system of women. So if you're in those drugs, even if in alcohol, you can quit smoking, you can quit alcohol. Yes. The other modification you can do, if you are stressed, you can see a therapist or a counselor if there's something that is disturbing you, because you cannot be able to conceive when you are stressed. It's about diet. You can improve on your diet. And even before you can conceive, you can see a doctor to tell him or her that you have the plan to conceive, of which you are given drugs that help the conception to be good, to prepare the uterus and to prepare the reproductive system in general. The other modification that you can do is If you are maybe certain medication that you are taking, you can ask your doctor if these drugs are okay and I'm planning for conception. The other modification you can do, if there are those who are maybe having family planning, they can stop for the time being, and then they can plan to conceive. So generally, lifestyle modification, or even change of environment, or change of work if the work is too busy.
Stressful.
Because also, as a couple, you need to be together, so that when you're in your fertile days, it's the right time for you to conceive. So you can also go to the hospital and be taught how to identify the days that you're on ovulation, so that you can try as much as possible to practice sex those days. Yes. The other treatment is medication. If you have certain maybe illness, like the one who say the STIs, they are treated first. If it's cancer, it's also treated first, or other diagnoses are also made. If they are on other maybe thyroid or other endocrine conditions, they are also treated first. Then if it's hormonal imbalance, they are given also drugs to balance the hormones. They can also be given fertility drugs which assist in conception.
Okay.
From there, they can also be done other issues that can be done through the scan. We can see if it was a blockage of maybe fallopian tubes. Surgery can be done to unblock the fallopian tubes. If it's fibroid, the surgery will be done to remove the fibroids, the polyps. Yes. So surgery is also a form of treatment. Then we can also, if it's come to us and they have tried everything and they're not conceiving, they can go to assisted reproductive technologies. Of which you say there are two. We have the artificial insemination, where the sperms are harvested and placed in the human uterus for that baby to grow. The other one is also the IVF. IVF, they remove the ovaries, mature ovaries from a woman and sperm from a man, and they place them in the laboratory. And then afterwards they are placed in the human uterus.
Okay.
Yes.
Okay.
Those are assisted technology. If they have tried everything and just failed.
Okay.
Yes.
What about the men?
For men also, it's like the women. If they are lifestyle that they need to change, they need to be assisted to change. If they are stressed, you can also be seen by maybe a therapist or a counselor to know the issues that may be disturbing them. If they are also in drugs, they need to stop smoking, alcoholism, and other drugs because they cannot be able to conceive those drugs. Obesity also the same. They need to reduce the weight. If they have diabetes, it has to be treated, and other conditions in the body that need to treated first before you can conceive. The other one is also surgery. If there is a problem, you say maybe there was a torsion, also needs to be repaired. If there are blockage anywhere in the reproductive system, it's also unblocked and repaired. Any other problem that may need surgery in the reproductive system, it is done. And also, if it's impossible, and also drugs, there are drugs that are given for maybe
fertility,
to improve in sperm production, sperm motility, semen analysis, semen motility, that the sperm can also move fast. If they have other problems, maybe also drugs are given. Yes. And also they can be done, they are assisted now. It is not be placed in them, but the sperm can be harvested
and placed in the uterus of a woman.
Yes.
Can infertility be prevented?
Yes, it can be prevented. Like the one we said about, if it's because of lifestyle, you change your lifestyle. Yes. If it's because of maybe other problems that can be detected early, surgeries can be done. And if it's maybe because of maybe sexually transmitted infection, they are treated early. Before they bring complication. Okay. Yes.
There's a question
they stop maybe self-medication. When one has a problem, let her or him go to see a doctor. If it's diabetes, let it be managed the way it's supposed to be managed. Yes.
Okay. I was asking, there's a question that people ask a lot. Do contraceptives affect the fertility of a person?
Contraceptives does not. What they do, they can delay.
They can delay
the fertility.
Okay.
Especially some drugs like the ones that we give injection. The injection ones, we discourage even for a couple who has just one child in using it because it will delay to conceive the next pregnancy.
Okay.
Can delay even up to 7 years.
What?
Yes.
Okay.
But the fertility will return, but there is a delay.
A delay.
Yes. And also there are these other drugs that the girls would like using. The emergency contraceptives, the P2s, the emergency contraceptives, they are not the best because now they are used to stopping pregnancy every time they want to. They have sex. That drugs go and stop conception. So now the body will have been used to that process. Yes. So every time they conceive, the body rejects. Although maybe some cases like abortion, because of opening that cervix every 2 months, maybe 1 month, doing abortion, they have the cervical incompetence. That the pregnancy, they cannot hold the pregnancy. It will still have, they will have miscarriage. Yes.
You have talked about the drugs and the injections. Are there other types of contraceptives that people use?
Yes. There are condoms is also a method of contraceptives, which we say it's a dual method because it prevents pregnancy and infections. Then we have other, like the implants, some that they are implanted in your body. We also have the ones that we can call them devices that are inserted, like the intrauterine devices. They are mostly called coils. Coil is the hormonal coil
that people wanavanga hapa.
No, this one is the implant.
Oh,
coil
it is inserted.
Inserted here. These are implants for 3 years, 5 years. But we have coil that is inserted in the woman uterus, which make the uterus to be hostile for sperm to survive. And that's why they don't conceive. And the other barriers, we call the diaphragm, that there are barriers that are used
to stop fertility. To
stop sperm entering the uterus.
Okay.
There are many, they are different.
There are different contraceptives.
The tablets, the injectables, the coils are the devices, and the implants.
What is the worst case scenario that you have ever had of contraceptives?
The worst case is the one I was telling you about the delay.
The delay.
The delay in return to fertility, and also some cause hormonal imbalance.
Okay.
Yes.
Okay.
Yes. Now that the couple may come, that they are not able to conceive again, na inakuwa ni vita between the husband and the wife. Why were you using this and this? And we need to have to cancel them.
For a couple that is starting out, maybe their their fertility journey, why is it important to go for those early checks? Is it important also to go for early checks, or they should start when they are ready?
When a couple has planned that they are going to get married, it's very important or crucial to see a specialist so that they can be checked their fertility status. That one they will rule out of sexually transmitted infection, they rule out of any hormonal imbalance, semen analysis will be done, sperm production will be checked, other scans and ultrasound will be done, and x-rays to see if there is any problem in the reproductive system. Yes. And they are also given drugs that assist, especially women. We call them the folic acid, that they assist them so much during conception. And also food. They are also given, maybe the women, they are also told foods that they can eat with magnesium, which will help them in their sperm production and motility.
Is there a procedure or a process that a young couple goes through in their fertility journey? Let's say they have started, they have agreed to get married. Then after getting married, is there some things that they should do in their fertility journey?
Yes, that is within that 1 year. If they have not conceived, let them come. Also in their fertility journey, they are told if they want to conceive immediately, they need to have regular sexual intercourse and they need to be together. They avoid the distant relationship. Yes.
How can you support your
And they are also given maybe counseling on how to handle stress and things that can affect them. And also they are asked of their lifestyle, how their lifestyle is, and then they are advised accordingly.
Okay. Yes. Okay. If let's say one partner is going through infertility issues, how can you support such a partner?
They need to come for counseling and also to be elaborated on the issue, what is affecting maybe the woman or the man, so that the other partner can be in the picture and also be there to assist, maybe during the medication period, maybe through surgery period. We can also be of the support system to them and encourage them that the journey will be okay. Yes.
Okay. You know, there are myths and misconceptions around fertility and infertility.
Yes, yes, yes.
Let's discuss such myths. What are such myths?
The
And if they
myths
are
are
true or false?
The myths are there. Myths we say something that is not true, but people outside there, they talk about it, and it really affects if it's a couple or a person you affected psychologically, and it can bring to stress, and other people even separating, having divorce, and all that things. So the myths are not. We try to allay so much of the myth, and that's why we advise them to come to see maybe the specialist, to come to the hospital, and they are assisted. Some of the myths, especially they say it's a curse. Some say
you have been cursed.
That woman is cursed. The other one, they can say maybe that woman used to do abortion, of which they are not sure whether.
Yes, they are not sure. They're just spreading rumors.
Spreading rumors. That family has that problem of infertility. Maybe they also say maybe the family planning is the one that is causing the infertility. Those are some of the myths. But
is there a truth in? Maybe some people say that inakuwa shida ya hiyo familia. Can genes play a part?
No, we have not seen that infertility is a genetic problem. It is not a genetic problem.
Okay.
It's not.
Another myth?
Other myth maybe will be certain people, maybe in certain work, maybe like the military people, or people maybe in other careers, maybe drivers, yes, of which it's a myth. It's not true. The other one maybe, curses is the one that is more common. Yes.
What about the one that it's the woman's fault?
Yeah, that one you have at least reminded me. Because in infertility, people always blame
the woman,
not knowing that men also have a place to play. And also, it's like 50-50. It is 50 in men and 50 in women. The infertility cut across. And that's why we say if the woman is or a couple is experiencing infertility, they need to go to the hospital, both of them. Because a man maybe think it's a woman who is having a problem. And in the other case, it's a man who is having the issue. So kama ni kwenda hospitali and then nyote wawili. Because most of the time watu wanasema ni mama ndio ako na shida. Because they wanasema mwanaume hawezi kuwa na shida. That one is a myth that si ukweli. Hata wanaume wanakuwa na shida za infertility. Men also have the problem, and also major problem. Most of the time you find that men are the ones who are having problems. Yes.
Okay. What's your advice for couples who are facing the fertility and infertility issues?
One is tell them it's something that is common, and couples are assisted, or a person is assisted and they get the babies that they want. It's a problem that can be handled, and we have handled so many cases, and we have seen that afterwards the couple has successful pregnancies, have successful deliveries, have successful babies, and they are able to conceive. So it's not a problem that cannot be treated. It's a problem that can be handled in all those ways that we have said. And even the assisted reproductive, people are even going to that. And we have seen success in those stories. Yes.
Okay.
So if they are facing a problem or a challenge, they need to go to a specialist. We need to come to the hospital, and we take them through the steps and whatever we need to do, so that we can see where the problem is.
Okay.
If it's something like stress, we can also take them to counselor. If they are having any myth, we can allay and change the myth. Yes. So it's a problem that can be handled. It's only that they need to be patient as they seek the intervention. What is being done for them, they need to be patient. Hakuna haja they go and try somewhere else. Just need to be patient with one another.
Okay, I've just remembered something else. People say that traditional medicine can cure the infertility issues. Is that true?
Maybe certain foods that the traditional that were given to men and women during those times, they can assist. But drugs, I'm not sure. We are not sure because we have not seen. Because if it's a problem like fibroids, what can it be done traditionally? Nothing. We need to have to come to the hospital for surgery. It's blocked fallopian tubes. What can be done traditionally? Nothing. If it's hormonal imbalances, we need to come and be given medication. But maybe on diet maybe.
They can eat
food that they know traditionally that they are good for a man who is in the reproductive age, for a woman who is in the reproductive age.
Okay.
Yes.
Okay. That was good. Thank you so much for coming.
Karibu.
Thank you so much for giving such insight. Umetufunza.
Asante.
Where can people find you?
Okay. As you said, I work in Bahati sub-county. You can find me there. We also have gynecologists there, which they can also be assisted. It's a wide topic as that usually affects so many people. And so many people don't know where to seek help. They sometimes go to the tradition, they sometimes go to Nganga or other witch doctors, and there is a lot of mess. Yes. As they are waiting for God, because also prayers that does wonders, they still have to seek medical help. Yes.
Okay.
Yes.
What is one truth that you would want to spread so much about fertility and infertility?
One truth is that women are not the only one who has infertility problem. It cuts across men and women. And this is a problem that can be helped once they seek the medical intervention.
Okay.
Yes.
Okay. Yes. Thank you so much for joining us. I hope you have learned something about fertility and infertility issues in both men and women. Don't go looking for the witchcraft. Don't go blaming your wives. Go and seek medical help. Go and be guided by a specialist. And even as you trust God for a miracle, just go and seek that help that you need. And even if you are fertile, if you know someone who is facing the same challenges, the infertility challenges, help them. Tell them to go for counseling. That way that you will help them and their family. Well, it's been a good session. It's been a good episode. I hope you have learned something. I also have taken something home. And till next time, but remember to follow us on all our social media platforms. That is YouTube, Facebook, Twitter, Instagram, TikTok at Tumaini TV KE, and also on our website tumainitv.co.ke. Till next time, see you. Bye-bye.